ready? Thank you for joining me for today's weekly update. I'm joined today by Dr. Jose Romero, the Secretary of Health. I'm also joined by Gina, representing the Department of Education, and she'll be here for answering any questions. Let me first say we want to talk about 4 topics today. One, the current demand for at-home rapid tests, new isolation guidelines for positive cases we want to discuss today. Thirdly, the short supply of monoclonal antibodies and treatment regimes. And then, of course, the case report. Let me start with the case report that we'll put up on the screen. And today, sadly, we have the highest daily increase in cases since the pandemic started. That is 4,978 new cases in the last 24 hours. Of course, these are cases that are reported to the Department of Health. I remind everyone that with the rapid home tests that are still being done, we have no way of calculating those and putting that into the data. So obviously the number of cases that we got in the last 24 hours would be higher than that number, but even with that, that is a record high in terms of daily increase. And then active cases went up, and I don't want to minimize it. We've had 18 Arkansans that have passed away as a result of COVID, which is a result of this being around way too long, and the lack of numbers in vaccination that we'd like to have. In terms of vaccinations, we've given out 9,625 doses. I'm puzzled by the fact that with the emerging Omicron variant as to why that has not gone up more. It's possible that the pharmacists have not had time to enter in the data, and so you could see those numbers go up, and so we'll watch that. But that seems to be depressed in terms of a number with the risk that is out there right now, but we'll see over time. Of course, our immunization goes up as we see 2,000 more Arkansans are fully immunized. And then on hospitalizations, 0 increase in hospitalizations. And you know, it's probably has not been that steady of a flow around Christmas, because before Christmas people might delay going in. After Christmas they go in. There's a rush. We saw an increase significantly over the last few days. Today it's 0. We'll see how that plays out. Obviously I'm hopeful, and every hospital administrator and healthcare professional is hopeful that that number stays flat. In terms of testing, we have, you can see, one of the highest days in testing, and these are PCR tests as well as the antigen tests that are usually done through hospitals and the health units, because they're reported to us. But it shows that people are going in to be tested, which is good. They feel sick, they feel ill, they're suspicious, they get tested. I would point out that the positivity rate is now 19.7%, which is again the highest it's been since the pandemic began. So that increases the risk as well. In terms of new cases in the counties, unbelievable. Placer County having 1,158 cases. Statewide, a week ago, that would have been considered a big day. And here we see that number in one county, 439 in Craighead County. And then let me go to the second one before I actually go into the details of this. I've personally been to a number of pharmacists over the last few days asking for the availability of rapid COVID tests, and the answer has consistently come back, we're out. And they hope the supply chain will increase, but they're out. And I've raised my concern about this to President Biden last week, as everyone knows. And clearly the demand has increased because of Omicron, because of the risk that's out there, and the rapid rise in cases as well. We do have regular PCR testing that is available through the Department of Health, local health offices, through pharmacies, and hospitals. So you can get tested, but the rapid test is important as a tool to fight Omicron. And because it gives us a quick result, it allows the person to get early treatment, and it allows them to isolate, to protect others, and to protect their family. And so as a result of the importance of these rapid tests in our ability to fight Omicron, I'm announcing today that I have directed the Department of Health to acquire 1.5 million rapid home tests to be made available for free to Arkansans through local libraries, public health units, and other locations. I've also authorized the deployment of 10 National Guardsmen to assist in the delivery of the rapid test with urgency. And so 1.5 million, we're deploying the National Guard to help distribute these. It'll be available in those different locations. Let me emphasize that there is a shortage across the United States. We've been very creative in locating a supplier. I don't want to estimate exactly when that supply will be here. It's been committed to be here in a short amount of time, but we'll wait and see. But the day that it arrives, we want to be able to deploy it, get it into our distribution centers locally so that our citizens can pick it up. The cost is approximately $10 million and will be covered by the existing COVID response budget within the Department of Health. This will do a couple of things. First of all, it will relieve some of the burden on our healthcare workers, as well as help address the rapid spread of Omicron. Baptist Health has seen a record number of patients at its drive-through testing facilities. Each of these testing facilities takes healthcare workers, it takes staff that is needed in vaccination efforts, they're needed in care efforts, and so if we can utilize our rapid test in a more efficient manner across the state, then that will be a benefit in early detection, early action, and also relieving some of the burden on our healthcare workers. And now let me see what that, we'll talk about the isolation in just a moment, but I want to talk first about New Year's Eve and New Year's Day. First of all, I'm going to be getting together with some friends that I know have been vaccinated in a controlled environment. That's what I'm going to do New Year's Eve. And so I'm not canceling everything in life, but I'm also mindful of Omicron and the fact that we do have a spike in cases. And so I encourage everyone to be around vaccinated people. If they're not vaccinated, everybody should wear a mask, and they should socially distance whenever that is a possibility. Simply be mindful of the fast-moving Omicron variant. And then let me say another word about schools that will start next week. We are committed in Arkansas to in-classroom instruction. No, we're not stopping it. We're not changing course. And I know this is a challenge to our educators, to our teachers, but I think it's clear from our experience in the past that we have to be able to pursue the education. And we can't let this drop. We have to pursue that. It's so important to our future, to our students, to their mental health, as well as all the other activities that surround school. But I know that every school district will be looking at ways to protect the school environment. And so schools should consider what needs to be done for the health of students. The Department of Health stands by to assist. Masks are an option that each school district should consider depending upon the cases, the level of community spread, and the level of vaccinations. Judge Fox's ruling yesterday was very timely because that makes it clear without any doubt that the school districts have that ability to determine what is needed in their school environment to protect their students. And now, let me look at this, which is the new guidelines from CDC on isolation and quarantine that basically made it clear that 5 days was the solid time of isolation. This, first of all, is for the general public. There's separate criteria right now for schools. There's separate criteria for healthcare workers. This is for the general public, and we in Arkansas have adopted the CDC guidelines, which means that you stay home. If you test positive, you stay home for 5 days. If you have no symptoms or they're resolving after 5 days, you can leave your home, continue to wear a mask around others for additional 5 days. This is a significant change that will allow our workers to get back to work quicker with the right precautions. It will allow us to do what is necessary in society. If you do have a fever after 5 days, then you should continue to stay home until your fever has resolved. And then for those that have been exposed to someone with COVID-19, you need to quarantine. And we've adopted the CDC guidelines. I won't go through those all in particular, but stay at home for 5 days. After that, continue to wear a mask around others for additional 5 days. This applies to those that have completed the primary series of vaccines and are not boosted or completed it, or unvaccinated. That's the requirement in terms of staying at home. In terms of if you have been vaccinated, you have been boosted, then life is a little bit easier in terms of what you have to do. In terms of you don't have to quarantine if you've been fully vaccinated, including boosted. Now, I want to emphasize one final point before I turn over to Dr. Romero, and that is there's a lot of discussion about the lack of availability of monoclonal antibody treatments. It is in short supply. That's without any question. Let me emphasize that we are dependent upon the federal government on the supply and its allocation. In other words, if you're looking at testing, we can independently order tests, which we are doing. But in terms of monoclonal antibodies, that has been absorbed by the federal government. They have assumed all of the supply and are allocating it to the states. We ask for the supply, we ask for the allocation, and obviously it's a nationwide challenge. They're allocating it where they see the greatest challenge, and we have been getting a consistent level of supply. It is just insufficient, and we're asking that increase and pick up. We hope that it does, and that supply chain, but we are dependent upon the federal government. And then if we go to a couple more slides here, it just gives you the overall picture. That's a 7-day rolling average of confirmed and probable cases. You can see that we're getting high in comparison to our August peak. The next one that you'll see is the hospitalizations, and this is important to emphasize that we are still 1/2 of what it was in the peak in August when it was up over 1,400. In fact, that is significantly almost 1,000, 900 less than what it was at our peak. That is the key statistic I look at every day, talking to our hospital administrators. Where are we on our hospitalizations? Because we know without a doubt that our cases are going to continue to increase. We haven't reached the peak yet. They're going to continue to increase. What we've got to watch is the hospital availability and whether the Omicron is leading to hospitalizations. That's the number we're looking at, and we're still way below where we were at the peak. It doesn't mean they're not stressed. They are stressed in the hospitals, but it does mean that we are far below where we were. Again, if you look at vaccination status and hospitalizations, 84% of those that have new cases are not vaccinated. 87% of those that are hospitalized are not vaccinated. 85% of the deaths are those that are not vaccinated. I do this every week, reminding everyone of the statistics, look at the data, make a decision, get vaccinated. This is the proportion of eligible residents that have been Fully vaccinated, 53%. If you add fully and partially, you're looking at 65%. We're getting up there, but again, with the Omicron variant, as contagious as it is, partially vaccinated is not sufficient. Get fully vaccinated and get your booster. And this I wanted to bring it back to even looking at January. We had our first peak, in January of 2021. Good grief, time goes fly. We actually had our first small peak in 2020, but then in January it went way up, and then we had another August peak. And again, where you can see we're going, we're very likely to be higher than any peak that we've had thus far in the pandemic. Next, this is where I'm going to turn it over to Dr. Romero. He wants to spend some time talking about the treatments that are available. Dr. Romero.
Thank you, Governor. Good afternoon. So I'm going to talk a little bit about the monoclonal antibodies, our oral antivirals, and our pre-exposure prophylaxis. There's a lot of confusion on this, and this is changing over time. So these monoclonal antibodies, infusion therapies, are used for the treatment of individuals that have been exposed or positive, and they work depending on the variant that is predominant in the community. So we know that the BAM-EDI and the Regeneron are highly effective against the Delta variant, but it's important to note now that Delta is no longer the predominant variant in our community. We are dealing with the Omicron variant. And these therapies, the BAM-EDI and the Regeneron, have markedly decreased efficacy against the Omicron variant here in the community. So the treatment of choice today is the sotrovimab, the top monoclonal listed there, sotrovimab. And that also has effect against the Delta variant. Now, as the governor pointed out, these are in limited supply at this time, and in particular the sotrovimab. We will be getting more of these in the future. So for therapeutics to be effective, we really want to recommend that the sotrovimab be used. Now, physicians will discuss options with their patients. We are not dictating what drugs should be used, but that is right now for the public to understand that the drug of choice is the sotrovimab. When we talk about oral antivirals, we currently have 2 that are approved by the FDA at the EUA level. They are molnupiravir and Paxlovid. Okay, these also are in limited supply. These do work against all of the known COVID variants, including the Omicron. We will be receiving more of these in the future. These are extremely limited at this time. And lastly, there is a pre-exposure treatment that's currently FDA EUA approved, and that's Evusheld. This is given to individuals that need protection because they have a weakened or a less robust immune system to produce antibodies if vaccinated and are at higher risk. And so that's available at certain sites throughout the state for those immunocompromised individuals. Next slide, please. This slide shows you the weekly, and CLI stands for COVID-like illness emergency room visits. And it's the take-home message from this is for the parents of children. I want to show that we are starting to see an increase in the number of children. They are being seen in the emergency rooms, primarily in the 0 to 4 year and the 5 to 17 year groups. So these individuals are the ones that are coming into our emergency rooms and starting to see more and more of them. And I'm using this to show that this disease does affect children. It requires that these parents take these children to the emergency room to be evaluated. And we are starting to see increases in hospitalizations in childhood cases, primarily in New York and New Jersey, where this Omicron variant has taken hold, and we are going to start to see that here. And so the next slide, please. I also want to point out to the parents that for children 5 to 11 years old, newest data from the CDC published in the last day or so shows that these vaccines are very safe and effective. There's some concern among the parents about whether to use this. I want to encourage them to do so. These vaccines are being followed very closely, and we're not seeing increases in the numbers of side effects, nor are we seeing increases in one of the ones that has made parents very cautious about this is the inflammatory response that we're seeing in the heart called myocarditis. We're not seeing increases in the number of cases in children that are receiving these vaccines. So these are safe and effective vaccines, and I want to encourage parents to get their children vaccinated. We are below the national average at this time. And so I'll stop here and turn it back over to the governor. Thank you.
Thank you, Dr. Romero. Are there any questions?
You mentioned schools taking precautions. Do you think they should consider delaying coming back to school after the holiday break? And is that something they even could do if they wanted?
No, I would not encourage them to do that. We need to start. There's part of it is the routine of life. Part of it is the need to educate our children. We had some deficiencies when we went virtual, so we need to start our school, and they're prepared, put in the precautions that they've had before. We've been through this before. We can be prepared again.
With those at-home tested kits that you mentioned, how will those be distributed? Is it based on population or another factor?
We're still developing that, but the initial shipment should be based upon population per capita, and that's a good question that we'll adjust as needs arise and change as need be based upon experience. But this 1.5 million sounds like a lot when you have 3 million in our state, but if you have a household of 4 and they are tested twice a week, then you can see how these tests would be used up very quickly. And so this is a good supply to start with. There's no guarantee that this will be available 30 days from now. We'll have to see how it works, see the success of it and whether it needs to be continued, and also depending on where we are with the Omicron variant. But we want this in every county. That's why it might be available in the library, it might be available in the local health unit. They'll be available, and then we'll make sure that they have an adequate supply based upon the population.
For specifically Pulaski County with these in-home tests, will they be mostly distributed by the hospitals, or the hospitals involved with this at all?
No, we're trying to take the hospitals out of the equation, and so like in Pulaski County, we're looking at our library. We want to work with them if they're willing to put them there. It might be in other places where citizens, it's easy to pick up. Obviously, the local health units are areas that they can be picked up as well. Dr. Romero, did you have any further comment on that?
No, exactly that.
Can you speak on the accuracy of the rapid tests?
Yes, the rapid tests are not as accurate as a PCR test, and they can have false negatives, but they're still a very useful tool. And so it's rarely do they have the false positive. They might have a false negative, but it's still considered a highly reliable tool to use, and sometimes you'll test and you might test it again. And so they're a good tool, and they're something that citizens but also doctors rely upon more and more. Dr. Romero?
Correct.
Okay.
With the amount of positive cases we're seeing and the possibility of more hospitalizations, are we preparing for that increase?
First of all, it's unknown. As you can see today, we had 0. The Omicron variant does not lead to hospitalizations as quickly as the Delta variant. We have more people that are vaccinated today. So it's a little bit of a wait and see. Dr. Romero makes a point, and others, that it's the sheer volume. Even if you have a much smaller percent hospitalized with the huge volume of Omicron cases, is that going to lead in and of itself to increase in hospitalization? Likely it will. We hope that it will not near be the level of what we've seen before. But to your question, are we being prepared? I've started that conversation, and we have the facilities. For example, we built out in the last surge more hospital space for surge capacity. So the facilities are there and ready to go. Once again, they are staff challenges. And that's where you have to bring in outside nurses. You have to worry about the staffing of it, which is already a challenge. And so when you talk about the pressures in the hospitals, it's simply because the staff might have to be quarantined themselves, might have to be isolated, but we are planning and preparing in the event that is required.
I think it's time to reinstate the statewide mask mandate.
No.
Tests, you mentioned that some people were testing positive, but then that's not tied into some of the data from the Department of Health. What is the best way for people who are taking these tests to report the data to the Department of Health?
So first of all, if you use a rapid test and you show positive, call your doctor. Call your doctor and find out what directions they would give you. Secondly, isolate so you don't expose anyone else, and follow the CDC guidelines on isolation for 5 days. See if you have, any symptoms then, and then wear a mask after that. In terms of reporting, we're not asking them to call into the Department of Health or report that data. That would just add another burden on somebody who is challenged with their health requirements. And so it's just a reality of that element of not having that data on hand. We will see the data if they go to the hospital, and we hope they do not. But that is, as I said, the consistent data point that is concrete. We can measure it daily. We know what it means. Are there?
With this many cases, are we having to do any adjustments to our contact tracing?
Dr. Romero, do you have an answer for that?
At this time, we have not made any adjustments in our approach to contact tracing or investigation. That is something we're investigating now. We're considering it. It's simply easy to see that with the increased number of cases, it's almost impossible to keep up with it, since we're now at the level we were at the previous peak, and we expect to see that double by next week. So there may be changes forthcoming.
Dr. Mayor, who is actually producing the test for our rapid test? Are we producing that here, or is that coming from outside sources, other countries?
It's coming from an outside source. I believe the test is called an iHealth test, and it is in country. I don't know where it's produced outside of the country, if it is, but we will be receiving it shortly.
Let's go remotely. Are there any questions remotely?
Yes, Governor. This is Ryan with Arkansas Democrat Gazette. Can you hear me?
I can.
Thank you. So for quite a while, experts have been saying that the rapid at-home test would be key in the COVID response, and other states have moved much quicker on this topic. Earlier this year, Ohio purchased 2 million rapid at-home tests, and months ago, in August, they were making those tests available to the public at libraries. Why wasn't this decision made sooner by your administration, and what took your administration so long to come to this conclusion to buy rapid tests?
We had adequate supply, and first of all, and then secondly, the unanticipated challenge was that the administration reserved 500 million rapid tests, and that cut the supply even further. And so that's the reason we're doing it today. We're able to find a different supplier that will meet our need.
And you mentioned healthcare staffing being an issue. why wasn't there a healthcare staffing plan to prepare for a winter surge? Why does the state have a healthcare staffing plan for their winter surge? And if not, why wasn't one created?
We do have a surge plan. We had one in place for the last surge, and we have one that's currently in place. So we know exactly what to do in the event there is a hospital surge, including the staffing aspect.
Thank you.
Hi, Governor. This is Samantha with KNWA. The CDC has revised its estimates of the prevalence of Omicron in the country and our region. What are y'all's thoughts on this, you and Dr. Romero, and what does this mean for our safety measures?
They say that again. They revised their estimate of doubling time. Is that what you said?
No, sorry, the prevalence of Omicron in the country and our region.
Well, I'll respond and Dr. Romero can, but it's an example of, I talked about it, I believe it was last week or the week before, where they had estimated that the prevalence of Omicron nationwide was over 70%, and that in our region it was over 90%. And that was 1 week after we confirmed the first case. So clearly they were projecting, and they projected wrongly. And they have revised that, and it's just an example of people are using their best judgment on the best data they can. Perhaps they should be more careful, but we know that they're trying to get as much information out and be transparent in what they know, and they've revised it accordingly. Dr. Romero?
Thank you. I think it's time that we stop focusing on the name and look at the numbers. It's clear that we're seeing significant increases. Those significant increases in cases are due to the Omicron variant. Delta was here before. We didn't see that increase. With the Omicron, we're seeing large numbers. Whether we have 65, 85, 95% prevalence in the state is, I think, irrelevant at this moment. We are seeing significant numbers of cases. The logical cause is Omicron. We are adjusting our therapies and our recommendations for quarantine and isolation based on that fact that we're seeing more cases, and it is probably Omicron without a doubt.
Any other question?
Yes, good afternoon. It's 4029 News. Are there any guidelines or restrictions when the free tests are available? 2 per household, 10, 20, etc. Possibly sending potentially sick people to the library to pick them up. Is that the best plan, in your opinion?
Well, I'm not, tell me if I'm not catching your question, but if you have tests that are available at the library and you have a family member that should be tested, I would suspect that someone who is not potentially infected would go pick it up. And so I think that's not any different than right now you go to the pharmacy to pick it up. So we're just making it more available and more convenient for them, and of course it will be free of charge. Was there another part to your question?
Yes, are there guidelines as far as how many testing kits per household to
Yes,
make that supply?
we will, as those goes out, we will provide those guidelines. It's too early to do that right now. We've just placed the order. We will be working on the specifics of that between now and the time we receive that 1.5 million and before they are distributed. And I've used libraries, local health units as example. There might be better venues that will come up that can be utilized, and we'll certainly take that into consideration and make that widely known as to where the public can get those home tests. Final question. We have one back here.
When you talked to the president last, did he bring up the possibility of using presidential powers to supplement and increase the supply of the rapid testing? Because I know he has those powers to do that.
He actually did. He's used the Defense Production Act. He has used it for testing. He will use it in other ways as needed. He did not provide any more specifics, but both administrations have used the Defense Production Act. It's a very important tool as we look at the supply chain. So absolutely, that needs to be used in every respect, whether you're talking about testing or whether you're talking about the development of the anticlonal or the monoclonal antibodies. Thank you very much for your attention today, and have a happy new year.